Hi, and welcome back to Hudson Valley Myofascial Release. I'm going to be discussing the importance today of breathing and its relevance to myofascial release as well as overall health. We encourage everyone, not just myofascial release patients and therapists, but everyone to start paying more attention and being more aware of how we breathe and the importance of proper breathing. You know, today with society, everything is fast moving and fast paced, and, we have a to-do list and our schedules are pretty tight, most of us anyway, and the importance of breathing is going to affect our overall health as well as our performance at work and at home in our relationships. So if we start to pay attention to whether or not we're breathing shallow with our upper respiratory muscles or we are breathing with our diaphragm muscle, it's going to make a huge difference. If I'm breathing shallow with my upper respiratory muscles, then I have a buildup of carbon dioxide within my lungs that's not getting out. So I'm going to teach you the difference between upper respiratory breathing and diaphragmatic breathing. There's an oxygen and CO2 or carbon dioxide exchange that takes place within the lungs, within the alveoli, that are little grape-like clusters within the lungs, that when we're taking a deep breath in, the gas exchange is happening within the capillaries, and the oxygen is going into the bloodstream and the carbon dioxide is coming out and being exhaled. So the diaphragmatic breathing is, if I take a deep breath in through my nose, my belly should expand like a balloon. So as I breathe in, my belly expands, and as I exhale, it deflates. That can ensure that I'm getting the proper amount of oxygen, or I'm getting enough oxygen into the bloodstream and I'm getting the CO2 or the waste out. The CO2, the carbon dioxide, builds up if we're rushing and we're running and we're not breathing properly or getting enough cardio exercise. And when the toxins build up within the lungs play a key role in regulating the hydrogen ion or the alkalinity within the bloodstream, within the cerebrospinal fluid, because it diffuses into the cerebrospinal fluid. So the part of the brain, the medulla, then triggers the chemoreceptors to contract, which will cause an increased rate and an increased depth of breathing to bring that back into equilibrium and homeostasis to resume normal breathing. So if we're breathing properly, or we're paying attention and we're more conscious and aware of our breathing throughout the day, and we pay more attention and we're making sure that we get regular exercise, even if it's just a walking program, then we can ensure that we're releasing the carbon dioxide, getting that out of our systems, which will allow us or help us to relax and be at ease. So anytime you can take 5 or 10 minutes throughout the day, whether before work, lunchtime, after work, in the evening, go sit in silence, clear your mind of all thoughts, and sit and do some deep breathing exercises. Or even throughout the day, if you catch yourself, breathing shallow. And an example of breathing shallow is if I breathe in, my chest is going to raise up instead of my belly coming out. So if I do this, my belly goes in and my chest comes up, that's opposite of what I should be doing. So if my chest is rising upward toward the ceiling and my belly's not coming out, it's going in, that is the opposite of what I should be doing. All right, so when we are receiving enough oxygen into the bloodstream, it allows for our minds to be sharper and more acute. It affects our dispositions and assists us in relaxing. Some of the success that I've had with the disease processes involving the lungs, your COPD, your emphysema, your asthmas, costochondritis. Costochondritis, by the way, is a tightening or extreme pain within the intercostal muscles that are between the ribs. So any of the disease processes involving the lungs, many of these clients do receive some relief, and they're able to expand their rib cage more because of the tension and the tightness in the musculature in the thorax. When that tension and that tightness is released somewhat and they're able to take a bit of a deeper breath, it allows for the rib cage to expand a little more. When a person is, say, on the table and we're working in a certain muscle group or releasing a restriction, I encourage the person to breathe into the restriction, to close their eyes and maybe take a deep breath in through the nose, and on the exhale try to relax into that restriction and allow that restriction to let go. It is taught as well for them to then follow up with the home exercise program, whether it be the foam roll or the small ball, and for them to be proactive in their home exercise program and releasing those restrictions as well. And again, they're taught to breathe into the restriction, holding that for 3 to 5 minutes or more, to really allow the restriction to let go. So it's important for them to breathe properly and assist that release on the exhale, and breathe into it. And it's nice if they add music, and it adds to the relaxation process with their home exercise program. So anyway, I'm looking forward to the next video and seeing you again soon. It will be on nutrition and food and its importance and relevance to myofascial release. We'll see you soon.